How you doing? Good to see you.
At Dr. Samir Segal's medical practice, there's not a sheet of paper in sight. The old files are sitting in the basement. All his patient records are now electronic.
With a paper record, it was very tedious. It was difficult to document and it was difficult to follow up. Here it's present at the click of the button.
To cyber-savvy patients, that might seem obvious, but much of the medical community has been behind the curve. The government estimates that just 40% of doctors in the U.S. have converted from these to at least a basic electronic health record. To increase those numbers, the government subsidizes local experts to help doctors convert. They say when it's done right, it leads directly to better care.
We're seeing improved rates of blood pressure control, of diabetes control, of people quitting smoking.
President Obama's new health care law encourages doctors to join networks and share records electronically. The downside is that different practices use different software, which aren't always compatible, and sometimes technology breaks down.
There are times where our workflow stopped because internet access wasn't great.
Dr. Sangpak just began switching over a few months ago. That means scanning old records one page at a time and learning a whole new system. But he says it's an improvement from the paper trail.
Every time we need to share data, we would have to stop our work and communicate by phone or by fax.
He says the change is overdue and hopes it will bring the American medical system back to the cutting edge.
Am I on time for?
Alison Harmelin, CBS News, New York.
Your cases are running on time.